guys, welcome back to Medical Coding with Blue. Today's episode is all about addressing the assumptions of a nurse turned medical coder. If you are brand new to my channel, welcome. I am Blue, I'm a medical coder. Okay guys, so I got this comment and this comment inspired today's episode. So I'm going to read the comment and we're going to get into it. So here we go. All right, the viewer says, "Hi Blue. I am an LPN and I got an offer to work as a medical coder at a nursing home with rehab unit, but I am scared. What is the difference between inpatient and outpatient? And where should I go to study to do a good job?" And I said, if you're asking that question, please don't go into medical coding yet. And I said, you need to learn more. And I said, just being a nurse won't help. And it's true. So sometimes people think automatically that nurses are going to make fantastic coders. There are some nurses that make fantastic coders. It's anybody that can make a fantastic coder. And there's people who have lots of education, who are medical trained or medical school trained, even for that matter. And it can go either way. Having lots of education doesn't necessarily mean that you will understand medical coding and all of the rules and what it means to add this modifier, that modifier, or this procedure code or that procedure code, or why the sequencing is for the diagnosis the way that it is, or why we have to select certain diagnosis codes and not others. So being a nurse doesn't necessarily mean that you're immediately going to make a fantastic medical coder. Now, the reason that I told this person to not become a medical coder just yet is because I don't want this person or anybody who's put into this position to be approached with this type of career field. And this is the first experience that you get, that you're thrown into the deep end of the pool with no idea what you're really getting into. Because if the person was asking me, what is the difference between inpatient and outpatient? No, a big no. You need to do schooling first before you attempt to try to be a coder. Because again, sometimes when nurses tell me, "Oh, Blue, I've done coding for years," and then I ask them, what is your version of coding? What do you mean when you're saying that you're doing the coding? And they go, "Oh, well, we have the super bill and I just circle all the codes that we normally..." No, that is not coding. That is selecting from a super bill. Coding is when you are looking at the documentation and you are deciding which codes to select based on what is there, what is documented, what is proven, as far as like what can be supported, right? And if not, then it has to be queried. So just the fact that you've selected these codes, it doesn't mean anything. It's just exposure to the codes, but it's not really going to help you in that critical thinking day-to-day as a medical coder. You need to go to school for that. You need to do self-study for that. Either one, okay? Either one you can do. When it comes to the school that I recommend, I have always said that you can go directly to the associations themselves, the American Health Information Management Association or the American Academy of Professional Coders. Both of them have their own online medical coding study programs. And the only reason that I can recommend them is because it's the association themselves. Neither one of these are paying me to promote them. I'm just sharing what I feel comfortable with. There's lots of trade schools out there, and these trade schools, there's no guarantee with who you're going to get. There's no guarantee with the quality of the teacher that you're going to get. I've heard many horror stories about schools that have teachers that are not certified, or the last time they were certified and worked in the real world, it was ICD-9 times. So if that tells you any indication, sometimes it's just that they have the education, but do they have the experience to be a teacher? That's a whole different thing. And then if you're not trained properly with how to teach adults, that's another thing. And so there's a lot of things that go in with it. And sometimes people get sucked in because they say, "Oh yes, we have a teacher you can ask questions to." And then when they get into the program, the teacher doesn't really want to answer questions, and it's a whole big old mess. So what I have said many times on my channel is to go through one of the association programs to learn medical coding, or get the books yourself. I do have the independent study video link that is in the description box below. It's got the syllabus, it's got all the books that you need to study and practice with, and it's the same thing as if you're going to a school, because it's covering everything that you would learn there in those books. But you're doing it without the middleman of the school and having to pay all those fees, okay? You can always hire a tutor if you're going to go the self-study route. You can hire a tutor so that way you can get that one-on-one versus being one of many students, right? And now I'm not just suggesting it just because I'm a tutor, but I am suggesting it as just an alternative if that's what you want to do. Because people ask me for school names. I can't specifically give you a school name because I haven't been to these schools. And when I have been approached in the past to do a collaboration with a school, I did not like even the way that they were even talking about it, and the fact that they did not have the certifications like that they were offering. They were offering a certification that no one asks for, and still insisting that I work with them. And I said, heck no, because when it comes to my audience and my people who I talk to on a daily basis, I'm not giving anybody information that is going to mislead them. I want people to be set up for success. I do not want people to be taken advantage of. It's very upsetting when I see this happen, but it happens because health information is a business and a school is a business. So again, if you're not careful, you can be taken advantage of. And I see this a lot with nurses because people will sell this and say that it's so easy because you've been a nurse. Being a nurse, and this is one of the assumptions that about nurse turned medical coder, one of the things that they say, well, it's so easy for you because you know medical terminology already. Knowing medical terminology and anatomy and pathophysiology is good. It is fantastic. It is very good. However, there's a lot more to it than that. It's more than just knowing the anatomy. It's more than just knowing the disease process. It is also being able to marry that with the guidelines. And sometimes when I've tutored nurses before, they say, well, Blue, this just doesn't make sense. Why would they say that? I don't know. It's the CPT book or it's the ICD-10-CM book. I don't know. I don't know why they do this way. But that's just the rules, and that's the way that it is. And so sometimes it's very difficult for nurses to take that nurse hat off. And sometimes I've seen nurses who think that they should code a certain thing, and it's actually not that way because of whatever reason or whatever the rules were or whatever. And so with that, they're just like, well, that doesn't make sense because there's all these things here. I said, but it's not definitive. It is, suspected, likely, maybe probable, and it's an outpatient encounter. You can't do that. It has to be what is definitive. What do we know for sure? If it is, we don't have a definitive diagnosis, then we're going to go with the symptoms. Well, how do we know which symptoms to go with? Because this could be for this or that. And again, it goes back to comprehending the documentation. So there's a lot of things that I know that nurses struggle with when they look at some of these things. And then the way that some of the questions are worded, even in the workbooks, they'll talk to me about it. They go, Blue, this isn't right. This does not happen. This is like, I know, but this is the question, and they're just looking for you to find the answer. That is what they're looking for. So I know it is a struggle for some nurses because they get really deep into it, but please know that medical coding is not easy for anyone. And I'm not saying this to scare people. Some people get really upset with me because they say, well, Blue, you're just trying to scare people. No. I'm trying to prepare you. If anything, I am trying to prepare you. And I'm not here to challenge you either. Whether you get into medical coding or not is really no difference to me, because the simple fact that everybody's going to do what is right for them and their life. And whether it is listening to me or not listening to me, again, it goes back to why do I do this? I've been a medical coder for 15 years, and the better part of my adulthood has been medical coding. And I've seen a lot of things, and I don't like when I see people being taken advantage of. I don't. And I like what I do. I love it. I love going to work every day, knowing that I get to educate my providers and knowing that I get to help them grow, as far as like, knowing things and learning things about the coding side that can help prepare them for the future. Because I know that all my providers will not stay with me. They will be there for a short time and then they will go on to private practice, or they'll go off, to another hospital or whatever. But I want them to be set up for success, because I tell them, you don't know who your coder is going to be. Or even if your facility is going to think that coders are important, because believe it or not, there are some facilities that don't understand what we do and our importance, and they want to rely on the electronic medical record, which is not right, because the electronic medical record is not always right. It's going based on what is selected or what the algorithm says is good and things like that, and it's not always right. It's not always correct, because this is artificial intelligence and it doesn't have the critical thinking that we have. We have critical thinking as human beings. But as coders, we have to be supremely educated, because we have to know what doctors know while never having gone to medical school. This is not to scare you. This is to prepare you. People who have high school diplomas and even people who have GEDs, who have their certification, have gone on to be fantastic coders, and they do wonderful things, and they do very well for themselves, even though that's what they have, right? And it's the same thing for anybody that wants to get into this field, okay? So it's not about, oh, well, I need to have all of this. These are skills that you can build with time. And that's something that nurses have to understand. You are the same as everybody else coming in. You just happen to possess a really wonderful knowledge base of anatomy, whereas the rest of us medical coders that don't have that had to hurry up and catch up, But once you catch up, then it's just like, okay, And I've heard from some nurses who say, well, Blue, I've only done this kind of nursing for the last few years, and I've forgotten a lot of the other stuff for the other body systems, and I need to have a refresher. And if that's you, please do the refresher. It will only help you. I talk about the nurse who got it confused, perineal and perineum. She got them confused, and I'm like, okay, those are two very different things, like, come on, but she got them confused, and she forgot, and so two very different things, guys, again, as nurses, that, but nurses who go into coding, it's a great transitional field, because you still get to use your knowledge base in medicine, and you also, get to solve the puzzle. Everybody talks about it's a puzzle. It's literally a puzzle. Every single encounter that you see, even though there's codes that are already selected by the provider or by the electronic medical record, they're not always correct. And you have to verify to make sure that those codes are supported with the documentation. And if it's not, then you have to select the most specific code available. If not, you have to query them. And another great thing about nurses that go into coding is that nurses that go into coding have that built-in relationship with providers right away. Whereas coders who don't have that background have to really work at building those relationships, because it's not always immediate, okay? And so that's something that you have to know. This is not a discouragement, again, to my people that are not nurses, but it is just something that you should be aware of. But sometimes with some of these surgeons, with nurse turned medical coder, they're treated just like the regular medical coders as well. So just because they hear medical coder. But again, it all goes back to, how do you treat them? How are you treating your providers? If you treat your providers well, I'm not saying that it's always reciprocated. You as nurses, y'all know that. But it's always important to remain professional and be respectful and things like that. But if they know that you're on their side and you work at that relationship of, I'm here to support you, we're teammates, you can see a lot of wonderful things happen when they build that trust with you. right? When they know that you're in their corner and you're not here to chase them with a red pen and tell them that they're wrong and, really beat them down because I'm querying them and I'm going to teach them a lesson. They don't have to learn lessons from you. They're doctors, okay? What you need to do is be their teammate, okay? So that's just what I'm saying about that part. But if you get offered a position in coding, don't just take it just because, I'm a nurse. It should be easy. Do yourself a favor and go through a course or go through the independent study. Get the books and start looking at them. Because if you're in a position in coding, you should not be asking questions like, what is the difference between inpatient and outpatient coding? That should not even be. You should know what the difference is if you are going to pursue that path. Now, if you're just starting, naturally, that's going to be a question that you're going to ask. But don't accept a job that is going to require you to know what the difference is, because there's different rules for outpatient coding and for inpatient coding. And then there's also different rules for facility coding. So yeah, there's a lot of different things that happen because sometimes you'll hear, this is inpatient. You're coding for inpatient. And sometimes they'll mean facility and sometimes they'll mean professional fee. So you have to make sure you understand the difference and know what the difference is. So again, that's why I say it's very important, and that's something that's going to let you know if you're ready or not, if you're still asking those questions, or if you're getting through a program and you say, okay, well, I'm studying right now and I'm going to sit for my certification in a few months, in 6 months. And they say, well, they want to hire me already. And you have a good base foundation as far as you understand modifiers, you understand how they apply, you understand, what is the difference between a primary diagnosis and secondary diagnosis, and you understand injury coding and sequela and all of these things. You understand all of these the way that they should be and the rules, then you're okay, because then it's just getting the certification is more of a formality than anything else at that point, right? Because you truly do understand. But if you don't, it's okay to admit that you don't understand something. And for some nurses, I know that they struggle with that. And I'm just being honest because, guys, I'm the one who gets those messages. I'm the one who talks with the people. And this is what they tell me. This is definitely not to put anybody down. This is just because I'm talking to you guys straightforward. Because I'm not going to sit here and hold anybody's hand and sugarcoat anything. Because if I did, I would be no better than the other people who are trying to sell you programs that you don't need or you're not ready for, So that's the thing that you need to understand. When you hear me say something like this, it is because I want you guys to be aware that medical coding, it takes time to build that knowledge, but once you start building that knowledge, it really gets easier once you start building it to build it even more, because then things start to really make sense, And I see a lot of nurses that have lots of potential. And sometimes just the thought of like, oh yeah, I got this, it kind of gets in their way and they don't study quite as much as they should. And again, I'm the one who gets those messages from nurses who have failed the exams. And they're like, Blue, I don't know what happened. If you don't study it, it's going to show in the results. So you have to study. You are just like everybody else that has to study medical coding that's never done it before. Okay, because again, like I said, circling diagnosis codes and procedure codes does not a coder make. It doesn't. And I only say that to save you guys. I really do say it to save you, so that way you understand that this is something that's completely different. And I know I'm not a nurse. I'm not a nurse talking to other nurses, so it may be a little bit more, well, I don't know. She's a civilian, so. But it's just one of those things, guys. I mean, whether you get into it or not, it is a wonderful career field. And like I said, you can apply those skills that you've learned in nursing, and it helps after a while. And especially if you decide you want to keep growing in this field and you want to get into CDI, clinical documentation integrity. And sometimes people try to push nurses into CDI without them knowing anything about coding. You can't do that. Now, I say you can't do that. It's not an industry requirement that you know about coding or that you've spent lots of time being a coder. But oh, I want to sneeze so bad. um, it's not an industry requirement. However, it does help for you to understand what does the coder need or want, and as far as like their wants in like, okay, can we make sure that the provider documents the date of injury, or you know the how the injury happened? That's a want, you know. Can it be coded without it? Probably, but I mean, you want the most specific coding to happen, and how can you know that if you don't have those dates, right? Or if you don't have that information? And external causes are very important as far as injury coding goes. It is very important to collect that data, and nurses turned medical coder turned CDI are very helpful with that because they can explain that to the provider as well. That the reason that we have to collect those external cause codes is because they can really help in times of like needing to get funding for certain safety programs for a certain area. I always give the example of the state of Colorado when they had plenty of spiral fractures there and they couldn't figure it out at first. But you know, the most popular outdoor sport in Colorado is downhill skiing. And when you ski downhill and you come to a sudden stop, there's some twisting of those bones. And so that's how you end up with spiral fractures. And that is how they came up with those safety campaigns, because, hey, we were having too many of these and people were hurting themselves. What can we do to protect the public? So, you know, that's why these things are important. It's always important, guys. The details do matter. And that's just something that I do want to share, you know. But if you are on your way to becoming a medical coder, or even if you're being pushed into a CDI role, make sure that you get on with that coding. And it doesn't hurt for you to understand the coding either, okay? Because it's just going to set you up for success, and it's going to make everything much more easy to understand as far as like explaining why it has to be there and where can you find those references and resources to help the provider to understand why it all needs to be there. I'm just saying. So with that said, best of luck to you if you are a nurse. And as I said, the three ways you can learn medical coding: the American Health Information Management Association, the American Academy of Professional Coders, or do independent study. Any one of those three. You can certainly go to one of these programs that's online, these schools, but I do not recommend programs that are less than 9 months. Do not go on a program that's less than 9 months, because 6 months is way too fast. I'm just saying. With that said, I'm going to go ahead and wrap this one up. Thank you guys so much for joining me. If this video helped you, please like, subscribe, and share, and I'll see y'all next time. Bye.